Good afternoon or good evening, everybody. Hello and welcome everyone to the first episode of Practitioner's Perspective. I'm your host, Rahul Goyal, co-founder at UB Health. UB Health, born out of personal experiences of founders, has an integrative platform to help people in all stages of mental health and wellness that enables personalized care and compassion. Today, we are here to talk about the future of mental wellness in the workplace 2022. And joining us today is Dr. Gerry Bodeker. Dr. Bodeker, a trained clinical psychologist, did his doctoral studies at Harvard and researches and advises on integrative medicine and wellness. He has researched and taught in medical sciences at Oxford for 2 decades and is an adjunct professor of epidemiology at Columbia University. He works with the private sector, governments, and UN organizations, including WHO, the World Bank, United Nations Development Program, UNDP, and the Asian Development Bank, advising on culturally themed wellness policies and strategies. He has published 6 books, with 2 new books in press, and recently co-authored a chapter on wellbeing and mental wellness in the Oxford Research Encyclopedia of Global Public Health. So let's get in. A recent Big Health report that focused on unmet need in mental health at the workplace. Here is a quick synopsis. Companies are implementing mental health programs, but they don't know which ones are working. Senior leaders are advocate for employee mental health, but initiative to bridge the gap between saying and doing lag behind. Current mental health care is not reaching all employees in need. 60% of people who meet diagnostic criteria for a mental health condition do not receive care. Dr. Gerry, what do you think of these trends? How do we approach these individuals in a way that meets them where they are?
Hi, Rahul, and thank you for inviting me to make this presentation on the future of mental wellness in the workplace, 2022. We'll address those questions as we go through this, but I'd like to start off with addressing what is mental wellness first. And as you see, this is drawing on work done by the Global Wellness Institute, and I chair the Mental Wellness Initiative for the Global Wellness Institute. We see this characterization of mental wellness as an internal resource that helps us to think, feel, connect, and function. It's an active process, and its goal is to build resilience, to help us to grow and flourish. It's not just mental, in other words, the thinking process, but as you see, it involves emotions, connecting, and we've got social dimension there, but we should really say environmental dimension, because nature is an important part of this, and our connection with nature from where we come is critical as well. And then there's the functional dimension as well, the psychological dimension. I want to share with you this dual continuum model of mental wellness and mental illness. As you see on the horizontal axis, the purple text, this is really the old model of mental illness, a spectrum from low to high mental illness, through to low or no mental illness. But the mental wellness dimension is really a spectrum that has flourishing, thriving, growing as its goal. And the opposite of that is languishing, a sense of purposelessness, of lack of momentum. So it's this dual continuum model is important to understand. We're not looking at mental wellness as one step further along from mental health. It's a different way of looking at things. It's active, it's engaged, it's promoting flourishing. Now, there are many pathways to mental wellness, and in a moment I'm going to share a link with you to this, the white paper on mental wellness that colleagues and I prepared through the Mental Wellness Initiative of the Global Wellness Institute, presenting many, many different pathways of achieving a state of mental wellness and flourishing accompanied by all the science around that. And what I'd like to say is that, going back to this slide, you see on the left mental and on the right physical. Both mental and physical pathways are really important to engage with, and they both contribute to something that we've come to understand as neuroplasticity, the capacity of the brain to grow and lay down new pathways. So much so that studies on meditation, on certain forms of exercise, have found increased gray and white matter in the brain of practitioners of those excuse me, modalities. So we have this report here, and at the end of the talk, I'll share a link to that as a free download for everybody. But we can't really talk about mental wellness in the workplace or mental wellness anywhere in today's world without talking about COVID. COVID-19 has challenged the world in so many ways, as we all know, and mental health is high on the list of areas of our lives that have been impacted. Indeed, the World Health Organization has declared mental health as a parallel pandemic to COVID-19. That's pretty important for us to understand. And what does this mean? How does this translate? Here's a study that was published just a few months ago in April in The Lancet, a leading international medical journal, a sample of more than 250,000 subjects, patients diagnosed with COVID, and 1/3 of them, 1/3, had some neurological or psychiatric diagnosis in the following 6 months. Now, if we're talking about workplace wellness, that's likely to be that 1/3 of the personnel in a company who have had COVID, 1/3 of those are likely to have some neurological or psychiatric consequences of having COVID. Here's a study done by Boston University School of Public Health. My former dean at Columbia University, Professor Sandra Galeo, who's now dean at Boston University School of Public Health. They found that depression in the general public, we were talking about people with COVID, but in the general public, in the community, is 3 times higher during COVID than before. So again, back to the workplace, we're going to expect that a significant percentage of the workforce are going to be dealing with depression. There's a lot of talk about post-COVID. I personally don't understand this term post. How do we get to post from where we are? I don't see it. It's a global phenomenon that's going to rebound for quite some time. We are mid-COVID, not post-COVID. And so threefold higher prevalence of depression. And a big factor in driving that, again, this is for employers to understand, is that people who don't have a lot of savings and are thus exposed to big impact from the pandemic have the greatest risk of depression. And then we've all heard the term long COVID. What does it mean? It's commonly used to describe signs and symptoms that continue or develop after acute COVID, and there are no proven treatments, and there's no agreed rehabilitation guidance. And this affects people's ability to resume normal life and their capacity to work. You have to understand this. So again, from the workplace perspective, we cannot not consider COVID. You see from these few slides that there's a significant effect on society from the increased healthcare burden and economic and productivity losses. It's substantial. This is from The Lancet just last month. This is very current. I'd like to share with you the findings from a Harris Poll survey of employee mental health that was just released last week. And I'd like to acknowledge my colleague, Melis Gelula, who's a member of the Mental Wellness Initiative and a board member of the Global Wellness Institute, for sharing this with me. Harris Poll were commissioned by Talkspace, a digital mental health care company, and they surveyed people between July and August about their satisfaction with the work situation. What people were reporting is that their employers promised them that they'd respect worker and health safety. They also vowed to prioritize employee mental wellness. But more than a year and a half later, 2 of every 3 employees who consider leaving their job agree that their employer hasn't followed through on the early promises to focus on employee mental health. They haven't kept their word. According to the survey, half of the employees believed that work has become too stressful, and at least 25% are underperforming due to stress. A lot of them are thinking of changing jobs. 41% said they're likely to change jobs due to stress. That's burnout, a lot of it. Not only burnout, but a lot of it is burnout. 38% are not just considering changing jobs, but changing careers. This is very profound. This is COVID shaking up people's life direction, not just their job. More than a quarter said they're likely to quit their jobs in the next 6 months. And 27% they'd quit even without another job lined up. So this is a pretty serious situation. We need to understand this about the workplace. The people who are considering resigning, more than 2/3 of them agreed with the statement, "My employer claimed to focus on mental health at the beginning of the pandemic, but has not followed through." And again, more than 2/3 agreed, "My employer says employees should focus on self-care, but doesn't provide the resources to do so." And I go back again to the Mental Wellness White Paper, where we give all of the different pathways to mental wellness that can be used as self-care modalities. But people in a workplace need support and motivation to do that. We've even found through research, new research, that apps that offer guided self-care, use drops off somewhere near halfway through use of the app because there isn't personal engagement. So apps need that personal engagement. Employers need personal engagement. Self-care can be a cop-out. And I'd like to make the point that just as we've seen in the environmental movement, there's what's called greenwashing, where companies make statements and positions to position the company to look as though it's environmentally friendly and sustainable, but in fact isn't. I'd like to introduce the concept of wellness washing. And I think that's what's happening here. Companies want to look good, but they're not necessarily walking the talk. Some are, but a lot are not. And here's an interesting last point here. More than half of people who were thinking of leaving said that more mental health services would make them more likely to stay. So here's what the employees are saying employers need to do to enhance the workplace. For a start, they want supportive managers and a culture of well-being. We're going to come back to that, a culture of well-being. This is at the top of the mind of employees right now. They'd like paid time off for mental health. 3/4 of people surveyed would like paid time off for mental health. They want transparency about the company. They want to feel that the company is telling them the truth about what they do and what they're going to do and lives that through. They'd like open door policies with managers. Again, more than 2/3 are feeling they don't have that. They want training on managing mental health, not just an app. They want training how to use the app. They want support contextualizing that. Again, about 2/3. Same amount would like subsidized counseling and therapy. Now, this is a changed workplace landscape that we're seeing here. We need to understand that. COVID is the backdrop to it. And here are tips for employers from the survey team. One is elevate mental health to a company value, not just as an add-on, as an HR box to tick. It's got to be a company value. It's got to be normal to have conversations about mental health on an ongoing basis. And it needs to be embedded in that company value that each employee is unique. It's not one size fits all. It's that personalization is really important. The second thing that comes out of this report is that mental health training needs to be offered, familiarizing people with the tools to manage their mental health, not just here's an app or here's a book or here's an article, go and do your self-care. They want training in how to use this and support. And then finally, there's this point we came back to about transparency and consistency. They want companies to walk their talk. They want to see managers model mental health and set personal boundaries. And this makes employees feel empowered to do the same thing. So the culture of well-being in a company has to be on the front burner now. We have a parallel pandemic of mental health and mental illness issues, according to the World Health Organization, that demands that well-being, flourishing, thriving, not just absence of mental illness, is front burner as a core value for companies. My colleague at Oxford, the founder and director of the Oxford Wellbeing Centre, Professor Yann-Emmanuel Deneuve, he and his colleagues have recently published a new study that, and this is looking at it not from the problem point of view, but from the solution point of view. They found that worker well-being is pivotal in increasing business productivity, that one standard deviation, one statistically significant notch up in worker happiness was related to an almost 20% improvement in the person's weekly sales. And they worked with BT, British Telecom in the UK, and with salespeople and people resolving customer problems, which is a high stress frontline position with several thousand people over 5 years, big study. And they found that one statistical notch up in measurable happiness by a worker is associated with an almost 20% improvement in their weekly sales. That's something for companies to take on board, even if they're not sort of deeply committed to well-being. If they realize the business benefits of making it front burner, then this is evidence to support that. What Yann-Emmanuel has reported is that they found that social and emotional intelligence are heightened when people are in a better mood. So they're interacting with customers in a more nuanced, more positive, pro-business kind of way when they're in a better mood. How do they get in a better mood? All the ways we've been talking about in the previous slides. If they don't feel treated well, as we've seen in the previous slides, they'll leave fairly quickly. And what they point out, the Oxford Wellbeing Centre team, is that that's a big cost. You know, attrition is a big cost because you have to attract new talent. You've got the recruitment costs. You've got the time in training personnel. You've got the time in them going through the learning curve. So the take home really is the longer that a company can retain employees, the more cost effective it is. And in this time of COVID, what's going to retain them? Mental well-being. Mental well-being at the core of corporate values, supported mental health and mental well-being programs with training and backup, and a workplace environment where leaders model well-being, mental well-being. Not just talk about it, but live it and model it. So this is from Professor of Global Mental Health at Harvard in the School of Public Health. And I thought it's a good sort of cry to us. And he said in a current issue of Harvard Magazine, how do we make our society realize that mental well-being is as important as physical well-being? And he says this challenge is only going to become more urgent as we continue to face the stresses of COVID-19. Again, that's a professor of global mental health who was formerly one of the directors of the World Health Organization. It's going to become more urgent. We're not talking about post-COVID. More urgent as we continue to face the stresses of COVID-19, of racial disparities and climate change. These are all going to impact on people's mental well-being in the workplace. We have to realize that mental well-being is as important as physical well-being and has to become center stage in company values, backed up by an infrastructure of support. Thank you very much.
Thank you, Dr. Gerry. That was very, very insightful session, right? A lot of data that has been put behind this. Very interesting aspect of, I would say, analysis done by yourself and your colleagues in this area. And interesting perspective on the solutions as well that employers can adopt and bring to their workforce. It benefits both the employers and the employees. In terms of Dr. Bodeker, some of the up and coming, you would say, aspects of self-care that you foresee even in your research and your career that maybe you want to share with some of our audiences?
Sure. Well, I have just put in the chat box the link to our white paper on mental wellness. If you go to the chat box, you'll see that link there, and it's a free download. As I say, it has as many of the pathways to mental wellness as we were able to identify, with all of the science supporting their efficacy. So self-care really is in recognition of the fact that there are not and will never be enough therapists to go around. It's a fact. WHO publishes data by regions on the number of psychiatrists per head of population, and it's always the category of medical practitioner that is the lowest per head of population. WHO also publishes estimates of the percentage of unreported, undiagnosed mental health conditions, and that's hugely substantial. So basically, the answer is not that mental health issues will be solved by a psychiatrist or psychologist or psychotherapist, or that mental wellness issues can only be led by a wellness coach, although there's undoubted benefit to both. But we have to realize it's our life. Just like nobody can get on a treadmill for us, doesn't matter how rich we are, we still got to get on the treadmill ourselves. Yeah. And it's pretty much the same with mental well-being, that we've got to get on the mental wellness treadmill ourselves. And it's not dull, it's not boring, it's fulfilling, it's thriving, it's enjoyment. And enjoyment and wonder are outcomes of these pathways of meditation, of being in nature, of a whole food nutritional approach to diet. There's so much evidence we've covered in the white paper that shows that these pathways enhance mental well-being, reduce depression and anxiety, and give people a sense of control. Movement, dance particularly, is associated with increased gray and white matter in the brain, but particularly increased gray matter, cortical growth in the prefrontal areas of the brain, which are associated with higher reasoning, problem solving, elevated mood, and so on. And so these self-care pathways are very important. But I think it's also good for us to acknowledge the value of support as we do this. This can be professional wellness coaching, it can be a buddy, it can be a trained meditation teacher or yoga teacher. It can be someone who knows about appropriate nutrition for mental well-being. It's helpful to have a guide to get going in this, but it's also helpful to get our own wings, because at some point we're going to want to stop paying for a guide, and we don't want the whole thing to fall off a cliff at that point. We want to be able to feel like, you know, we got big wings, we're a condor, and we're running to the edge of this big cliff, and we soar, we don't plummet. So early stages, it can be helpful to have a support person, and even intermittently, in and out, on and off, to have a support person, professional or personal. But ultimately, we got to get on the treadmill ourselves, and we got to stay on it ourselves. So making it our life, a lifestyle, not just a little routine, is important.
Absolutely. That was very insightful, Dr. Gerry. Thank you so much for coming on this show and sharing
Most welcome.
about mental health and what the future of mental wellness in the workplace should look like.
Sure. Thanks for inviting me, Rahul. All the best.
Thank you again for coming, and for our viewers, we'll be back in a few weeks with our next practitioner perspective with another practitioner. Stay tuned. Thank you so much, everybody.